Well, if you're a caregiver for a loved one, you already know the challenges that you face on a daily basis. Now, add to that all of the post-COVID challenges, especially when it comes to the healthcare industry. If you're trying to be an advocate for your loved one, you know that it's getting to be more and more difficult. Well, joining us this morning is Jennifer FitzPatrick. She is the author of this book, Reimagining Customer Service in Healthcare, and has been an advocate for seniors for, I don't know, over 2 decades, right, Jennifer?
Long time.
A long time. So, here's the thing. Your book, customer service, that's not a word that we're hearing a lot in healthcare these days. So kind of give us the breakdown. What is the biggest challenge you see seniors facing these days when it comes to healthcare?
Well, right now it's visitation. Even though most organizations are really better with visiting and letting families come to the hospital, to the senior living communities, to the nursing homes, some are still, the numbers are up. Don't accept that. Push back. It is not a good idea for anybody to be in a healthcare environment without an advocate. It's not a good idea at all. So offer to take a COVID test, but don't allow your loved one to be in any kind of healthcare setting by themselves. Just push back and tell your legislators, tell the organizations if you're dissatisfied with this.
And go higher up the ladder if you need to. Thank you for giving us permission to do that. That is so, so important. So let's talk about going into taking our loved one out in doctor's office visits and things like that. Sometimes we're getting pushback from them allowing us to even come into the office. How do we handle a situation like that? Because you say it's really dangerous to not be present for a situation.
I believe it really is dangerous because you need a second pair of eyes and ears. You want somebody else to be asking questions that you're not thinking of. It's a very stressful situation. So again, push back on that. And if for some reason they won't allow a loved one to be in there, you can have that exam and then you make sure that you do a telehealth where your loved one is present. Do not accept not having an advocate be part of your care.
Oh my gosh, good advice. All right, is there anything we can do to prevent a situation from going wrong? I know we expect there to be customer service in healthcare, but we're hearing the staffing shortages and things like that, which then we find ourselves doing even more for our loved ones, especially if they're in a facility. What would be your best tip?
Just do the best that you can to be polite and gracious during this difficult time. There truly is a shortage across every profession: pharmacy, nurse, social work, doctor. So I know you're frustrated. I know your loved one doesn't feel well, but just do the best that you can to be gracious and patient and give them a little bit of grace right now. The people that are showing up are usually doing the best that they can.
Yeah. Just have a little extra dose of patience. Let's talk about social media, because in those instances, you see a lot of lashback, right, on social media, this place or that place. And I'm not sure how I feel about it. How do you feel about it? Is that really a good idea?
I don't recommend it. You want to talk to the staff. You want to go through the proper channels to talk to the staff. If somebody won't listen to you or nobody will give you any help or any feedback, then you might want to take to social media, because that does get the attention of executives. But be respectful in the language. Don't bash, like you said, Terry, because that's not going to do you any good with your relationship with the organization that your loved one is utilizing.
Yeah. You also mentioned on the flip side of that, being careful or gracious about posting photos of your loved ones when they're not really in a very good place or situation. That's also not a good idea.
Think about, if you take a picture of your loved one when they're in the hospital or they're sick, would you want someone to put that picture of you online? No. That's the best barometer. Would you want that really shared? And I think that helps give people pause. It's okay to share, especially if you have your loved one's permission, but be mindful that screenshots can be saved, things can be forwarded. So something the information gets to people maybe that you wouldn't, or your loved one wouldn't be so comfortable with.
Jennifer, always good to talk to you. I always feel better about this process. Thank you so much. And of course, we have a link. You're welcome. We have a link to Jennifer's information on our website, sonoranliving.com.